staff for the opportunity to present to you today. I come to you today as we celebrate the 35th anniversary of the North Carolina Rural Center, and in the context of a state that has changed enormously across 3.5 decades. Yet through all of that growth and change, North Carolina remains, in the words of Rebecca Tippett at the Carolina Demography Center, a persistently rural state. We have the second largest rural population in the nation with 3.6 million people. 35% of our state's population is rural. Only the state of Texas has more rural people than the state of North Carolina. We have the second largest number of small towns with less than 10,000 people. Only the state of Pennsylvania has more small towns. Our urban centers are less dense and more dispersed, and our rural communities are more dense than you find in a lot of other very rural states. And this works to the advantage of our state as a whole, creating a stronger, more diverse state economy. Many of our rural counties are within metropolitan statistical areas, with local economies well integrated with their urban and suburban neighbors. After the 2020 census, 78 of 100 counties are rural with less than 250 people per square mile. When it comes to the subject matter of today's meeting, the Rural Center does what we always do. We ask ourselves whether Medicaid expansion and closing the coverage gap will improve the quality of life of rural North Carolinians in the communities that they call home. We view this conversation through an economic lens, and we focus on rural people and rural places above all else. So what is the coverage gap and who falls within it? Individuals who make too much to qualify for Medicaid, up to 42% of the federal poverty level, and too little to qualify for subsidies on the marketplace, starting at 100% of federal poverty level. They cannot afford commercial insurance, and they do not receive employee-sponsored insurance. 1 in 4 are parents. A common scenario: the working single mother of a 5-year-old would qualify for Medicaid only if she made less than $7,240 per year. However, she would not qualify for marketplace subsidies until she made at least $17,240 per year. And there's a lot of people that fall into that gap in between. The majority are employed North Carolinians. 11.3%, or about 1,157,000 North Carolinians are uninsured, which is above the national rate of 9.2%. Of the total uninsured in North Carolina, a little over 1 million are working age 19 to 64, civilian, non-institutionalized individuals. 665,000, or 65% of them, are employed. This includes agriculture workers, construction workers, child care workers, cashiers, restaurant workers, delivery drivers. In other words, essential frontline members of our state's workforce. It is important to recognize this includes full-time workers, as employers with less than 50 employees are not required to offer insurance benefits, and those who would like to, as we will discuss later, are impeded by prohibitively high costs. 86.7% of the population without insurance in North Carolina is workforce age between 19 and 64 years old. North Carolina veterans, as you've already heard, are affected by the coverage gap, especially when compared to other states. 49% of uninsured veterans in North Carolina live below the poverty line, compared to a national average of only 20%. Rural individuals also make up the coverage gap. Rural people are disproportionately uninsured compared to their urban and suburban counterparts. 20 of the 22 North Carolina counties with the highest percentage of uninsured people are all rural counties. Those dark blue counties you see on the map have more than 20% of their population that are uninsured. The light blue counties, between 10 and 20% uninsured. The orange counties, less than 10% of the uninsured. So why is closing the coverage gap so important for our state in general and for rural communities in particular? There are three rural economic imperatives that I want to focus on. Closing the coverage gap serves as an economic solution with a multiplier effect to support the local economy while boosting local and state revenue. It creates opportunities for small businesses across the state by reducing barriers to established businesses and building the workforce. And it supports healthcare in rural areas by injecting funds to retain providers, save rural hospitals, and recoup previously uncompensated care. North Carolina will experience substantial economic gain with Medicaid expansion, with an estimated $168 million state and local tax revenue gained by 2025. In a recent study, researchers found that expanding Medicaid in the 12 states that have yet to do so would increase federal revenue by $49 billion and would create more than 1 million jobs in the country, with a projected 83,000 of those jobs being located right here in North Carolina. Increased federal Medicaid revenue has a multiplier effect, which will boost local and state tax revenues. Other studies support this, finding Medicaid expansion in other states between 2014 and 2020 improved affordability and accessibility to health care, improved health while reducing disparities, strengthened local providers, and ultimately funneled money back into the state economy. Other states that expanded, such as Kentucky, another very rural state, found Medicaid to contribute substantially to the state economy. In fact, Kentucky is estimated to have experienced a cumulative $819.6 million positive state economic impact through the 2021 fiscal year since their adoption of expansion in 2014. Expansion is expected to have created 40,000 jobs from 2014 to 2021 in Kentucky and resulted in a substantial reduction in uncompensated care charges at Kentucky hospitals. This chart illustrates how the money can funnel into the local economy and back to the state in the form of increased state and local tax revenue. How money flowing from the federal government through the state government to healthcare providers across the state and out from healthcare providers in the form of income to their staff and vendor purchases from the people they do business with. Ultimately, some of that is returned in the form of state and local tax revenue. In 2019, researchers projected a $7.54 billion increase in the expected gross county product over 3 years in North Carolina if Medicaid were expanded. These projections range from $233 million in the Northeast region and $372 million in my home region in the Northwest, to $1.6 billion in the Piedmont Triad region and $2.2 billion in the North Central region. It's important to note these numbers were projected in 2019 to be achieved by 2022 if North Carolina had expanded Medicaid, and they therefore do not account for the economic influence of the COVID-19 pandemic. 2019 research also projected $106.3 million in expected new county tax revenue over 3 years in North Carolina if Medicaid was expanded. Projections range from $3.2 million in the Northeast region to $32.3 million in the North Central Triangle region. Again, the same caveat applies. Rural small businesses drive and sustain local economies, but high costs of doing businesses can affect their survival and their profitability. 75% of all business establishments in North Carolina's rural counties have fewer than 10 employees. These are not only small businesses, they are very small businesses, and they are really the meat and potatoes of local rural economies. They're also among the most vulnerable. For small business owners, health care costs include providing care for their own families, as well as providing health care to their employees. Not being able to afford to offer health insurance and thus attract competitive employees greatly impedes their ability to start and/or grow their business. In a 2019 survey, small business owners identified the cost of health insurance as one of their top concerns. This was confirmed by our own 2020 regional entrepreneur focus groups with small business owners across rural North Carolina. Health insurance was listed as the primary support needed by small business owners. We heard this loud and clear and repetitively across 5 focus groups, regional focus group sessions, and throughout our 6-month process with our small business task force as we created North Carolina's small business plan and policy agenda. The comments we heard from our regional focus groups and our task force were similar to this quote from one Craven County restaurant owner. "Everyone wants health insurance, but no one wants to pay for it. It creates a barrier for small businesses. I would have to cut jobs to provide more benefits, and finding a middle ground is not easy." Many entrepreneurs reported being unable to afford health care for themselves, for their own families, or employees when starting their own business. Lack of employer-provided health care makes it difficult for entrepreneurs to recruit and retain qualified staff. Business, civic, and faith leader support for Medicaid expansion is growing across rural North Carolina. There are notable business leaders, local elected officials, and other civic leaders who increasingly support this policy change. Several Western North Carolina boards of county commissioners have passed resolutions in support of Medicaid expansion. This graph illustrates the difference in the number of hospital closures in the states that have expanded Medicaid and in the states that haven't yet expanded, and it's a startling contrast. Addressing the rural hospital closure crisis also helps address medical deserts. Medicaid expansion can help prevent closures, which retains healthcare job opportunities in rural areas, prevents loss of wages and benefits for local healthcare workers, supports the local economy, and allows local access to health care for rural community members. Uncompensated care from uninsured patients is a substantial financial burden on our rural hospitals, and it is ultimately unsustainable. Medicaid expansion can help end medical deserts, those communities with a dearth of providers and overwhelming need, which have only increased during the COVID-19 pandemic. And one final footnote, the health sector was the only job sector of the rural economy that grew between 2008 and 2014. It's a critically important part of the total workforce picture in rural areas, and it's critically important that we do everything possible to support the stability and the growth of this sector. Medicaid's expansion has the potential to support the existing workforce and to ensure future recruitment and retention of healthcare workers by increasing revenue in the rural communities where healthcare workers live and work. Paying providers through Medicaid expansion strengthens the capacity of our rural healthcare infrastructure, which means better health for rural constituents and greater stability in the rural healthcare industry. This stability can be further bolstered by allowing existing providers, such as nurses, advanced nurse practitioners, dental hygienists, and others, to practice to the full scope of their training and education. By boosting appropriations to the Rural Health Loan Assistance Program, and by overcoming barriers to telehealth access. In sum, closing the gap provides badly needed economic support in rural North Carolina. Medicaid expansion can close the coverage gap for low insurance and low income and rural working people. It can serve as an economic solution to help boost local economies. It can support small businesses to sustain our rural communities and our rural workforce, and it can prevent future hospital closures and support rural health care providers. Finally, in closing, let me acknowledge the work and leadership of several members of the Rural Center staff. Brandy Bynum Dawson, the Senior Director of the Rural Counts Advocacy Program, and like me, a native of rural North Carolina. Brandy grew up in Halifax County. Tori Keaton, our Policy and Government Affairs Manager, who acknowledges she isn't a North Carolina native, but she got here as quickly as she could. Miles Kirksey, who leads our Small Business Coalition as our Advocacy Engagement Manager and a native of Burke County. And finally, one of the newest additions to our staff, Leah Bouchard, our Director of Research and Data Management and a native of rural Caldwell County. Thank you.
Thank you, Mr. Woodie. Questions from the committee members? Thank you very much, Mr. Woodie. We appreciate your valuable information.
Thank you.
Next on our agenda, we have Mr. Peter Daniel. He is Executive Director of the North Carolina Association of Health Plans, and he's going to enlighten us on North Carolina's transition to managed care and prepaid health plans. Welcome, Mr. Daniel. Thank you for being here.
Madam Chair, thank you so much. We're excited to be here today. Excited to share what the prepaid health plans have experienced over the past few months. As Senator Kravitz said, my name is Peter Daniel. I'm the Executive Director of the NC Association of Health Plans. On behalf of the 5